Hi. I'm robo-Suzie and today I'll talk to you about plantar wart surgery. Also don't forget to check out the link below, to find out how to remove ugly warts caused by human papillomavirus. It's fast and painless. Awesome stuff. But back to our topic. Like any surgery, plantar wart surgery comes with its side effects. Whether or not this surgery is right for you is something only you and your doctor can decide after discussing your options and your health history. Typically, plantar wart surgery is not recommended unless you experience one of two issues: you are suffering extreme pain from your plantar wart that simply will not subside, or you suffer from a health condition that affects the performance of your immune system. Plantar wart surgery. For the most part, doctors will encourage patients to allow their plantar warts to go away on their own. Your body and your immune system will work overtime to push the virus causing your plantar wart out of your body. This helps to ensure that you are wart-free in a few years. Since most people don't suffer any pain or other side effects from plantars, it's not unusual for doctors to tell you to let it go away on its own. However, there are always patients who are at risk from warts. If your body suffers from a disease such as diabetes or HIV or AIDS, your immune system is compromised. This means that it simply does not have the power to fight your virus and cause your plantars to go away. What this means is that you will need to talk to your doctor about surgery to remove your wart from your body. Additionally, some people are prone to pain from their plantar wart, which makes life difficult and uncomfortable. What is a plantar wart? This wart is caused by the HPV virus. This is not the same virus that causes warts in other body locations. There are more than 100 different HPV strands. The one that causes plantars affects only your feet, causing them to suffer from warts. Most people only experience one wart at a time, but some people notice that their plantar warts grow on the bottom of their feet in clusters. These are the people who are more likely to experience pain from the existence of their plantar warts. These warts are only on the feet, though most commonly on the bottom. Since your body weight makes it nearly impossible for your wart to grow outward, many people are not even aware they have a wart. They assume they merely have a blister on the bottom of their foot because their body weight has pushed the wart up and in, causing it to form a protective blister. The one way you can really tell is by taking a close look at your wart. If there appears to be a plantar wart seed in the center of the blister, it is unquestionably a plantar wart. This seed looks like a small black pinpoint. It is not a seed or a pinpoint, however, it is a blood clot formed by the virus. The virus is picked up in a warm, dark environment. You can only get it if you have a wound on your foot that is open, causing you to become susceptible to the disease. The HPV strand that causes plantar warts is typically found around pools, showers, and in bathrooms, most commonly in hotels and gyms. However, if someone in your home has a plantar wart, you can catch it in your own shower. How you will not catch it, however, is through person-to-person contact. Surgery for plantar warts. As previously stated, surgery is not typically something your doctor will advise unless you have pain from your plantar wart or a weakened immune system. If you have either, however, your doctor will discuss surgery. There are two main types of surgery to rid your body of a plantar wart. Both will take only a few minutes but can cause up to a week of pain in your foot. The first type of surgery is nothing more than a minor surgery. Your doctor will apply anesthesia, typically a local anesthetic, to the wart and cut it out of your foot. You will be awake for the entire process, which typically takes only a few short minutes. Your doctor will use an electric needle to cut the wart out of your foot. It will be bandaged and checked on after approximately 1 week. Your doctor, and most doctors, however, will avoid this type of surgery if possible. The reason is that it will scar your foot. However, many people are uncaring about a scar on the bottom of their foot. If this seems like an acceptable trade-off for you, talk to your doctor about this type of minor surgery. The second type of surgery used to treat and remove plantars is laser surgery. This surgery uses a laser to penetrate the skin on the bottom of your foot, killing the virus and vessels from within. The wart will die over the next few days because it has no way of surviving as the vessels feeding it are now dead. As the tissue feeding and forming your wart dies and falls off. This can cause blistering, it can be painful to walk, and it can cause you to experience a significant amount of discomfort until and when your wart finally falls off. However, it will prevent your wart from continuing to form and it will kill the virus already in your foot. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.